taking time for your health. The African American Wellness Watch. Trusted information for us, by us. Dr. Mike LeNoir and other experts from around the country and around the world have the latest on how you and your family can get healthy and stay well. It's time for the African American Wellness Watch. A famous philosopher once said, if you don't know your history, then you're doomed to repeat it. Well, the Wellness Watch takes that admonition really quite seriously. So all this month, Black History Month, we will focus on health disparities that affect African Americans in a unique way. We will look to their historical underpinnings in hopes of finding strategies to address and eventually eliminate health disparities. And we're honored to have world experts to help us on this. First is Samantha Artiga. She's a vice president for KFF, which used to be known as the Kaiser Family Foundation, and that's the nation's premier independent source for health policy. Ms. Artiga is the author of a recent paper on the historical roots of health disparities. Ms. Artiga, thank you very much for joining us.
Thank you.
And of course, we have our host, Dr. Mike LeNoir, who through his 40 plus years of practice has fought to overcome health disparities that he's seen in almost every day, both personally and professionally. Mike, welcome to the program.
Thank you.
There's no question that African Americans are underrepresented in getting the latest and newest in healthcare. Some of that is because it's not offered to us, but also some of it is because we just don't trust the healthcare system. Maybe what we ought to do is take a look at what the level of distrust is. And I know KFF has done really terrific surveys on African Americans and others and their distrust of the healthcare system. Ms. Artiga, can you share some of that research with us?
Sure. So what we see is that experiences with racism and discrimination in the healthcare system are not just a problem of the past, but they continue in present day experiences. We conducted a survey of adults just this past summer in 2023. And what that showed us is that Black adults remain more likely than white adults to say they experienced unfair treatment or disrespect by a healthcare provider due to their race and ethnicity. They're also more likely to report certain negative experiences with a provider, things like being refused pain medication that they thought they needed, or having a direct question or request be ignored. Likely reflecting these types of experiences, we also see a striking finding of 6 in 10 Black adults saying when they prepare for visits with healthcare providers, they often take special care with their appearance in order to be treated fairly, and often prepare for possible insults from the provider or office staff. And consistent with these experiences, we see that Black adults are more likely than their white counterparts to really view racism as a major problem in healthcare, and to say that to have less trust in healthcare providers and doctors doing what is right for them and their community, at least most of the time. Although, despite these experiences, a majority of Black adults still say they trust their healthcare providers most of the time.
And often what we expect of some groups of people of color and the underserved is that because you are in a system and something comes on like a pandemic, for instance, and they come and ask you to take a shot or take a test, they don't know you, they've never seen you, you've made no attempt to engage them in community, and you expect them to trust you. And I think that becomes one of the biggest problems with the number of African Americans refusing to do things in the beginning of the pandemic, which kind of evened out over the course of years, was this lack of trust.
No, it's interesting when you take a look back at the historical underpinnings of this. I mean, and it's, Ms. Artiga, it's more than just Tuskegee, right?
Yeah, there's a long history of the medical system abusing and mistreating Black people that I think fosters some of the continued distrust among the healthcare system. So if we look back, we see that there was experimentation on enslaved Black women to develop new surgical procedures. And that was often done without anesthesia because of disproven beliefs of differences in feeling pain among Black people. There is, of course, the infamous Tuskegee study, in which the federal government left poor Black men untreated with syphilis in order to study the progression of the disease. And there's the use of cancerous cells from Henrietta Lacks after her death without her family's consent. And those cells were used for medical research and led to large medical advancements. I think since then, we've seen some steps taken to improve consent and research practices and to acknowledge and recognize some of the harms that were committed in the past. But those abuses and mistreatment continue to permeate, I think, people's consciousness and experiences today.
We did studies on this as well. African Americans were not concerned as much about Tuskegee when they were hesitant to get some of these diagnostic and treatments with COVID. They were upset about the system as it exists right now. That was their concern. They weren't concerned about Tuskegee, or a lot of them didn't know the history as we know it. But if you looked at the studies, the number one reason why there was so much hesitancy in the African American community is because of the way they're being treated now.
Exactly, but trust can be and is often ephemeral, especially when it has to be earned following years of distrust. Well, frankly, it's no wonder that doctors like Dr. LeNoir have little problem getting patients to try something new.
They trust me. And so consequently, they may be hesitant, but many of them, because I have been with them for so long in certain decision-making situations, it made it a bit easier. Although there were lots of my patients who said, no, Dr. LeNoir, I'll let this play out, and eventually you stop dealing with the hesitancy and just focused on the information that you had about how safe and effective the vaccine was. No, so not every patient, but I had that repository of people trusting me that allowed me to help them make the transition to get the testing and to get the treatments, the immunizations. But I think too often, as I've said before, so many people on these large systems, especially patients on Medi-Cal, Medicare, and these systems, and all of a sudden, a system that you really don't know anything about is asking you to take steps that you're hesitant about. And I think that made a big difference in how we looked at this whole situation.
And Ms. Artiga, if you take a look at the future, especially with AI and some of these new things that are being done with computers, I would guess that there's a potential for improving the situation around trust. But if what has gone into these computer algorithms is the same old stuff, then they could just perpetuate what's been going on for centuries.
Right. So I think when we look at both the growth in use of AI and clinical algorithms, as well as the development of new drugs and therapies, it's really important to keep an eye on disparities. So in terms of the clinical algorithms and AI, there's the potential for growing use of those tools to exacerbate disparities if they're built using flawed or biased information or have data that are not representative of the population. At the same time, they could potentially be built in really careful and intentional ways to root out bias and discrimination and help to mitigate some of those disparities. And in terms of medical advancements and new therapies, we similarly are seeing some disparities there. And part of that is rooted in terms of underrepresentation in clinical trials. Here we see that Black people face an array of potential structural access barriers to clinical trials. So not having easily accessible trial sites near them, having less access to transportation or technology, potentially more limits on eligibility for clinical trials. For example, if participation is excluded based on coverage status or having an underlying health condition. But to some of the points that Dr. LeNoir was making, I think we also see that many patients are willing to participate in clinical trials if they are presented the information. But there are also inequities in terms of patients having access to that information. But having that representation in clinical trials is really important because we also know, for example, that Black people are more likely to have confidence in a new treatment if they know that they were well represented in the trials that were used to test its safety and effectiveness.
Part of my career was at the Food and Drug Administration, and I know the FDA has put a premium on clinical trials that are representative, and they really force a lot of the companies to make sure that the clinical trials that they do are not just a bunch of people who live in Denmark.
Yeah, I mean, there have been a long array of actions taken to try and improve representation and diversity in clinical trials. Unfortunately, when you look at the data, there continues to be underrepresentation of people of color overall, and there continue to be gaps in reporting of racial and ethnic makeup of trial participants. I think in the development of the COVID-19 vaccines, we saw really concerted efforts to diversify participants in those clinical trials. And you saw engagement of the HBCUs in terms of trying to increase participation, and that they were overall more diverse, but still not fully representative in terms of the population. So there's still a lot of work to do in that area.
Well, I think this issue of clinical trials really has a lot to do with just trust again. You take the drug for Alzheimer's, 60.7 million people have Alzheimer's. It's the recent study on Leqembi, which is the one drug which reduces some aspect of Alzheimer's, although it's really not clear how effective it is. There were 1,700 people in the study globally, and there were 47 African Americans. And so consequently, trying to make a decision about how to give this latest drug in a very exciting era of research around Alzheimer's, African Americans represented only 2% of those people were studied. I think the issue is also that it takes a different kind of person to get into a study, because I've conducted all kinds of clinical studies here in the office and when I was certainly in the service. And if you got to get up in the morning and keep a card, and go to a meeting and go get these regular visits, it's a different kind of person. And I think for people who are challenged day to day with just food insecurity and job issues and racism, it's a bit much to be able to do that.
You're right, it is a bit much, but the key to solving the problem of getting Blacks to participate in clinical trials is the same key to solving other issues regarding health disparities, and that's trust. This has been the third in our series during Black History Month, in which we take a look at health disparities through the lens of their historical roots, in hopes that we can see a way forward. Dr. LeNoir?
Yeah, well, I'd like to once again thank Ms. Artiga and the Kaiser Foundation for the information that they provide. I have a lot of newsletters that I do, and there's a lot of plagiarism in those newsletters, and I always start with the best resources. So I think people should take advantage of getting that newsletter. You can keep up with not only with disease issues, but policy issues, which I think are just important. So I'd like to thank her, George. I'd like to thank you for putting together this very important series during Black History Month. And I want people who watch our program to remember what we always are concerned about. Health is your biggest asset. Protect it, and we'll try to help you do that.